Welcome to Doctors on Call. I'm Jenna Miller. We've been told that brushing your teeth twice a day is crucial in maintaining good dental health. But did you know if you don't brush twice a day, your risk of tooth decay goes up by 33%? There are more than 700 different types of bacteria in your mouth alone. It's no wonder your dentist encourages daily brushing, flossing, and twice-a-year dental checkups to not only prevent oral problems, but also general health problems as well. Today on Doctors on Call, we'll learn more about dental health and how it is important in preserving your overall health with Dr. Eric Johnson.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Closer Regional Hospital, experts, neighbors, friends.
Welcome back to Doctors on Call. Our topic tonight is dental health. Dr. Eric Johnson received his dental degree from the University of Missouri Kansas City School of Dentistry after graduating from Pittsburgh State University. His practice is located within Ad Astra Family Dentistry in Topeka and is a member of the American Dental Association, Kansas Dental Association, and the Topeka District Dental Society. Give us a call at 800-337-4788 toll-free with your medical questions about dental and oral health on Doctors on Call. Our show brings you information which may be useful to you when you visit your own physician or dentist. Thank you so much for joining us tonight. We're so glad to have you back and that you made the trip up here.
Thank you for having me.
Absolutely. Let's first, we always kind of like to get this question out of the way. Yeah. How has COVID impacted dental care?
COVID's had quite the impact. Back in 2020, when dental offices were shut down for about 6 weeks, we didn't quite understand how COVID was spread. Vaccines weren't available. But as we cautiously reopened, we had to take care of kind of a backlog of preventative care and care that had been scheduled during that time. And so a lot of dental offices were working hard to play catch up to take care of those patient needs for sure, which didn't happen during the shutdown. We still have some patients that are fearful about being in a dental office, and the American Dental Association has provided guidance for us on how to reopen safely, and the dental office is a very safe place to be even before COVID, but with a few extra measures in place, it's been going very well. During the pandemic, we've seen kind of an uptick in broken teeth, jaw pain, bite sensitivity, kind of some things that you would maybe point the finger at the stress of the pandemic causing, for sure.
Excellent. Now, what can a person do to try to kind of, I don't know if we'll ever get back to normal, but to try to overcome those things?
Sure. You know, in advance of your dental appointment, you can call your dental office, see what protocols are in place, tell them what you're comfortable with, ask them what they're doing. Most offices are going to do a really good job trying to welcome patients back in by making them feel comfortable.
Excellent. We had talked a little bit about this in the intro, but why are routine visits to the dentist so important?
There's a lot that we do at a checkup appointment besides clean teeth and look at x-rays. We're looking at much more than just the teeth and tissues. We're performing an oral cancer screening. We're screening for blood pressure. Sometimes we're even doing a sleep apnea assessment. So there's a lot that goes on, and that's why we're glad we're open again, because a lot of patients went a long time without that routine care that you get at a checkup.
Do you suggest twice a year or more often?
Great question. For most patients, 6 months works great. For patients battling periodontal disease or active and reoccurring tooth decay, sometimes it's good to look at that patient or clean that patient or read x-rays for that patient more often than every 6 months. Sometimes 3 months is ideal. Sometimes 4 months is ideal. And when you've got a good relationship with your dentist, they're a lot of times trying to customize care that works great for you.
You mentioned sleep apnea. How can a dentist help a patient with snoring and or sleep apnea?
Sure. You know, your dentist and your hygienist spend a lot of time in the mouth, and we're learning that the teeth and tissues, the musculature of the floor of the mouth, all those kind of have an impact on the airway. And we can tell by the presentation of the mouth, kind of quizzing you, quizzing your spouse, whether you might be at risk for sleep apnea. And a dentist can't diagnose sleep apnea, but we can be a good referral source for local sleep physicians, and might say, you know what, Bob, if you're snoring, it might be something to chat with your doctor about and be looked at for considering a sleep study.
So is it an important thing for a person, they might not think sleep apnea, snoring, dentist, for them to discuss with their dentist?
Exactly, yeah. You know, the gold standard for treating sleep apnea is a CPAP, a typical CPAP, and those work great. There are some patients that come to us or are referred to us by a local sleep physician who either declined CPAP therapy or not tolerated it well due to the fit of it itself. In those instances, we can take impressions, some bite relations, and make an oral appliance that, instead of forcing air in through the nose or mouth like a CPAP machine would, we can actually advance the lower jaw forward. And doing so gives the airway just a little bit more opening for that air to pass through unobstructed.
And speaking of sleep, I'm sure you see patients who tend to grind their teeth in their sleep. How can a person prevent that from happening?
Great question. So, why do we clench our teeth? The easiest thing to chalk it up to is stress, but that stress comes in many forms. It can be the stress of daily life. It can be the stress of sleep apnea. That's a form of stress that can trigger the body to do so. You know, we're always assessing our patients for the signs of clenching, the signs of TMJ. Sometimes that can begin as a problem that occurs in the joint. Sometimes it can begin as a problem that occurs in the musculature. And a lot of times we see its effects on the teeth, whether that causes broken teeth, flattened teeth, tooth pain in certain areas. There's a couple ways that we can help that. A lot of times we tell patients to kind of alter their diet, to maybe select soft foods, try anti-inflammatories, try a warm compress. Other times we might say, you know what, go try an over-the-counter night guard. See if you can get a benefit trying that for a short period of time. And that's what you kind of see right here. It's kind of a boil and bite. I call them a one-size-fits-nobody. But they usually do a good job maybe helping a bout of acute pain. Really the best way to help TMJ and clenching of the teeth at night is with a custom-made TMJ splint, and that's where we take impressions of the patient's upper and lower teeth. We take a series of bite relations where we're trying to position the jaw in a position that's favorable for the TMJ to relax. And we work hard to equilibrate the chewing surface so that it fits the patient's bite through the nighttime, kind of reducing some of the discomfort that can cause TMJ and clenching of the teeth.
Excellent. You're talking about stress. Sometimes individuals get stressed just coming to the dentist.
Yep.
Let's talk about it and how they can get past that.
Sure. Fear keeps a lot of patients from walking in the front door. Most of the time, you know, during a new patient examination where a patient presents and said, "Doc, you're lucky I'm here, but I'm scared to death." We always want to know, what is it from fear of the unknown, fear of the procedure, sound of the drill, the shot. Talking with patients and figuring out exactly what that trigger might be sure helps us work through that. And there's ways to medicate through that. There's laughing gas, there's sedation. I've found the best way is to talk to the patients. If it's the shot, walk them through it. Be as gentle as you can. If it's the sound of the drill, tell them what to expect. And really just kind of lowering their anxiety will allow you to get through some maybe of the initial procedures that we might do. And it's a big stepping stone when you have a successful procedure, whether that's a cleaning, a little filling, getting on to continuing care, and that's most important, building a relationship so they can come back and see you for those recare appointments.
And I believe with especially some of your younger patients, you have a very unique way of calming people down with music. Let's talk about that.
Music's a lifelong passion of mine, and if a kid is a little nervous or needs to be entertained, to be a good patient in the chair, I keep a guitar at the office and can play a bit of a tune to put them at ease and even give them a guitar pick when we're done. So we have lots of fun with kids for sure.
Okay, that's amazing. Very good. Okay, we've got a caller. We're going to go to the phone lines. We've got Driana on the line now. Hi, Driana. Go ahead with your question for Dr. Eric.
Hi, I was wondering if braces are just good for good looks or for other good things for your teeth.
Absolutely. Thanks for the question, Driana. Braces and Invisalign do serve a major aesthetic component. They do make our teeth look good. And that's what we see when we smile, right? One of the more important things they do is help with function. And that function, a lot of times, is making the back molars fit together. Those teeth have to fit together to chew. They also have to slide in lateral motions, side to side. And our teeth have to be able to slide front to back, side to side. So when you enter treatment, when you begin braces, the end outcome is not only the aesthetic benefit, but also a big improvement in function as well. So if you're having TMJ discomfort, bite discomfort, probably one of the best options to consider is orthodontics.
Okay, very interesting. Now, something that's kind of all the rage right now is your at-home clear aligner or whatnot. Are there risks involved with that, or what do you suggest when patients ask you about that?
Absolutely. We are getting a lot of questions about that. And when you think about how technology has impacted all industries and kind of streamlining services, it's not a surprise that this has come about. A lot of times what it will do is task the patient with taking their own impressions and then sending those off, or being scanned at a local mall or center where these scans are sent, maybe observed by a dentist remotely. But anyway, I digress, and there are a lot of things that an orthodontist or a dentist that's doing the braces has to monitor during successful orthodontic treatment. There are pros and cons with all procedures, and when you move teeth through the bone, doesn't matter whether you're turning a tooth, shifting a tooth, adjusting a patient's bite, when the teeth travel through the bone, there can be side effects or complications that have to be managed. If orthodontic treatment doesn't go well, you can lose teeth, we can lose jawbone, we can have major bite issues occur and TMJ pain that lasts long beyond the scope of care if it's not managed directly with the supervision of an orthodontist or dentist.
Okay, so I take it might not be the best option.
I would recommend against it.
Okay,
Yeah.
Okay, very good information. Now, when a person is brushing their teeth, cleaning their mouth, how important is to include the tongue in the cleaning?
Yep, the tongue is important. If you brush your teeth for 2 minutes, give that tongue another 30 seconds. A lot of bacteria live on the tongue. And, if you ever do notice a funky smell, halitosis, the tongue is definitely where you want to start. It deserves its time being cleaned as well.
How do you feel about your more natural toothpaste? There's a lot that have no fluoride included in them. Are you seeing any difference when a patient comes in and they're not using fluoridated toothpaste?
Sure. We tell all of our patients, look for the toothpaste that has the ADA seal of approval, and it will have fluoride in it. studies show that that fluoride level doesn't have to be very high to get the benefit that we want. Fluoride is really our only way to repair damaged enamel. It's really our only way to help areas near the gum line that are experiencing sensitivity. And so be cautious. I worry when I have a patient who's struggling with tooth decay and also telling me that they're using a natural toothpaste, because in their mind they're trying to do the right thing. They've been told that that's the best toothpaste, but it does not help our defenses against tooth decay if it's unfluoridated.
Okay. We were talking earlier about your younger patients that you sometimes play the guitar for. When do you suggest a child first see the dentist?
It's early as age 1. We have teeth erupting, and at that visit, we're not necessarily cleaning teeth or taking x-rays. We're just looking in the patient's mouth, talking to the child's parents, counseling them on home care, hygiene regimens. Kids can be one way or the other. They either love to brush their teeth or they won't let mom or dad help. And so just getting the kid used to being in the dental chair, used to those visits, the sights and sounds, the tools we use, can happen as early as age 1.
And how long should a parent help their child brush their teeth?
Quite a while. Probably longer than most of us would like to. It's almost until that child is in full adult dentition. So as long as there's baby teeth back there that need taken care of, the adult should either be helping brush or monitoring the brushing habits of the kid.
And what are sealants and who should get them?
Great question. So sealants are a great way to prevent tooth decay in both kids and adults. And as kids and children, we are typically at a higher risk for forming tooth decay. When teeth erupt into place, they have very deep pits and fissures when they're brand new. And those are notorious for holding on to plaque and food and some of the stickier foods that we eat when we're kids, like candy. And so what it does is it kind of seals in the grooves so that the food and plaque can't pass through the apex or the very bottom of that pit and fissure and form a cavity as easily. They're not permanent. They don't last forever. If you get 2 to 3 good years use out of a sealant, it's done its job. But they are a great benefit for kids and adults.
And we were talking, Driana had asked earlier about the braces. Is it possible to get cavities while you're under your braces or while you're in braces?
You know, when you have braces on your teeth or Invisalign buttons on your teeth, I think we see that home care necessity is magnified. Those braces don't cause tooth decay, but if there are any holes in our game as far as taking care of our teeth, be it brushing, be it sugar intake, braces can sure magnify that. And it's a tough age. You know, if you take a typical 12, 13, 14-year-old that's in braces, a lot of times what we see is the redness of the gum tissue. And so you have kind of the response of gum tissue and the hormones that are present at those ages. It can be really tough for teenagers to take care of their teeth while they're in braces. And I think it supports why an electric toothbrush is a phenomenal tool to have when you're trying to do so.
How important is flossing?
Just floss the teeth you want to keep. I think every dentist will tell you that. But yeah, toothbrush bristles can't do it all. They can't reach all the surfaces in between the teeth. And when you think about how many surfaces the teeth have, the flossing areas can be very prone to decay too if they're not kept clean. And so getting in between the teeth of flossing at least once a day, or maybe if that's not convenient, a go-between brush, just to kind of disrupt those colonies of bugs and plaque that form in between the teeth.
Okay, we're going to go to the phone lines now. We've got a
Awesome.
caller from Russell on the line. Go ahead with your question for Dr. Johnson tonight.
Okay. Yeah. Hello.
Hello.
Dr. Johnson. Say I'm a father of a young 3-year-old, and we're trying to get him to start brushing his teeth more often. And we're having a little bit hard of a time. I was just wondering if you could help us with some tips of helping to get him brush his teeth, and also your opinion on introducing or toothpaste with fluoride in it, and your opinion on some of the studies have been linked to learning disabilities and et cetera.
Sure. That's a great question, both of those. You know, with a 3-year-old, they're starting to build those, you're starting to see their personality come through, and you know, the best luck I've had is just kind of making a game out of it. Allowing plenty of time during the preparation of the morning before you head out the door, making it a priority before bedtime, and I bet you're doing that. Some of the electronic toothbrushes have an app that you can link to a smartphone, and it'll make kind of a game or a challenge out of brushing the 4 quadrants in the mouth and the tongue. And so that's one thing you can try, is kind of making a game out of it. Make there possibly be a reward system. Just make sure that reward's not sugar in the form of candy. But yeah, that's a great question, and I share in those challenges for sure with my kids. You know, as far as introducing children to fluoridated toothpaste, when we apply toothpaste for a 3-year-old, we want to select a children's toothpaste from the grocery store. We want it to have the ADA seal of approval and be fluoridated. But what's key is the amount that you apply to the toothbrush head. You're not trying to fill that toothbrush head up. In fact, for adults, it's a pea-size amount, and for kids, it's a piece of rice. A rice-size smear on the toothbrush is what you want to use. And that delivers a really small dosage of fluoride, and even smaller systemically. And you definitely want to make sure your child is spitting that out when they're done and not swallowing it. And I know the ADA is always studying these topics, whether it's fluoride in toothpaste, whether it's amalgam in filling materials, and the studies point that it's still very, very safe and extremely effective at preventing tooth decay. And so definitely recommend doing so, and good luck with that challenge.
And maybe he has a guitar he can break out, right?
If you play guitar, you should do that now.
Okay. We were talking about flossing before the phone call. I was wondering about the water picks. How are they as good as flossing?
You know, in patients that begin implementing those, we see a great benefit. I don't think that they're better, but they do a wonderful job. In fact, they're more beneficial in some certain situations. So like, let's say you have a bridge, and that bridge won't allow floss to pass through the contact. The patient is tasked with cleaning underneath it, and that can be pretty tough to do. And a water pick does a phenomenal job cleaning around bridges or implants, areas that might not be exactly like a natural tooth.
You had mentioned inflamed gums earlier. What about gum disease? What is it, and how can a person, how is that treated?
Sure. So gum disease is loss of the attachment apparatus that supports our teeth and their roots. Gum disease can happen at any stage in life, much more common in adults. And we're starting to recognize that inflammation, and specifically chronic inflammation, which is bad for the whole body, has a specific impact on gum disease, heart disease, Alzheimer's, diabetes. And so recognizing gum disease and treating gum disease is super important. Sometimes people with gum disease need to have a more specific and detailed cleaning of their teeth to address it, because once that bone is gone around the teeth, we can't make it grow back. And so the gum pockets around the teeth can be a bit more challenging to clean. They can be a bit more challenging for the patient to clean at home as well.
How beneficial is using mouthwash?
It's a great adjunctive benefit. It'll make your breath smell good. We don't recommend it in place of brushing or flossing, but a good mouthwash. Typically, we're recommending alcohol-free mouthwashes now. So Listerine without alcohol, Crest Pro Health, those are all great rinses to use after after you brush or in the middle of the day to disrupt the bugs trying to form on your teeth.
And how often should a person replace their toothbrush?
About every 3 months. Or if you're sick, if you've had COVID, throw that toothbrush away and get a new toothbrush head.
Is there any truth into, I hear microwaving your toothbrush can kill the germs. Is
Yeah,
there any truth to that?
That's a good question. I've never done that experiment. I might have to try that. You know, if that has any impact on the stiffness of the bristles, that might reduce the effectiveness of the brush.
Well, we're able to talk about a lot of things tonight. Thank you
Yeah,
so much for joining
absolutely.
us. We appreciate it. Our thanks goes out to Dr. Eric Johnson from Topeka. On our next Doctors on Call, we'll be discussing optometry. You can email your questions to us for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital. Experts, neighbors, friends.